and welcome to the Headache Doctor podcast. I'm Dr. Taves, and as always, it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. In today's podcast, I'm going to provide you with something very practical. One thing I've found is that people that are suffering with headaches and migraines oftentimes have a hard time explaining what is happening. And because they don't know how to explain it, or because they haven't been provided with an answer, they won't really talk about it. And that not talking about it means that people are not aware, potentially, that you are suffering with headaches and migraines, and maybe that your friends and family are unaware, or maybe you suffering through it without having an answer means that they can provide you with some sort of relief or assistance, but they're unaware that you're suffering through headaches or migraines. Now, kind of what I'm getting at here is when I work with people and they find relief and they're like, oh my gosh, like I've never had anyone talk this way or explain it this way, and this treatment is working, and they find their way out of headaches and migraines. Oftentimes they may know people that have headaches and migraines, and they'll tell them. But one thing that I believe is happening is that people aren't necessarily sharing if they have headaches or migraines. So maybe they cancel plans or things like that, but they don't necessarily use migraines as the excuse. This may just be happening in my head. But if that's a scenario, I want word of mouth to be as effective as possible. So I want people to be talking about this, and when you talk about this and you're listening to my podcast and you're understanding what I'm saying, or I'm speaking to you and you're like, yeah, this guy gets me, I want you to have a way to explain what is happening, in sort of a simple enough way that you feel comfortable saying, like, yes, I understand this, and when someone asks me what I'm experiencing, or what a migraine is, or what my headache is, that I can explain it, and it'll be reasonable and understandable. And so that way, if we can start to change the conversation and change how people talk about headaches and migraines, one, I think it'll be something that we're more comfortable talking about. People with headaches and migraines can see this as a neck injury and say, hey, I have an explanation behind why I feel this way, and I don't necessarily need to feel ashamed of it, or like I'm a problem, or like people don't get me, so I'm just going to keep it to myself. But you can have some confidence, like, yes, there is a problem, and there's a reasonable solution to solve that problem. And the other thing is, if we can talk about it more, I think the solutions will kind of come to the surface. So if the word gets out and people start talking more and more about their headaches and migraines being a neck problem, and let's say you go to your provider and you say, I think I have a neck problem. If someone else starts considering headaches and migraines to be a neck problem, maybe that provider will then, over time, we can wear them out and they'll start to think of these things as neck issues. Maybe physical therapists out there will start to give the neck more thought or more consideration than they have before, and patients can start finding relief. But really, I just think we need to get the whole conversation shifted from I'm a problem because the healthcare system, which has come a long ways. We have all this technology. These doctors are the brightest and best at what they do, and they can't figure out what's wrong with me. So I'm just this anomaly. I'm losing hope, and I don't know where to turn. I think we need to change the conversation to, there is a problem, and this is what it is, and this is how it's solved. And the actual issue is not me, but that there are very few providers out there that do this type of work, that can evaluate my neck properly and can treat it the way it should be treated. So you are not the problem. Our healthcare system has failed you. Be confident in that. That's what I see, and that's what I live out every day. Patients I work with, nearly every one of them has suffered through our healthcare system that has failed the neck. The neck is not something that's treated like it should. If it's not medication, injections, and surgery, then it's nothing. Physical therapy has not appropriately stepped into this field. Chiropractic is looking at alignment, which is helpful, but it's different than what you the headache and migraine sufferer are needing. And so the healthcare system has failed you. You are not a failure. It is our research, the trajectory that we've been on has led us down this rabbit hole. We're looking at stopping pain pathways and injecting things into our body. I mean, it's just kind of crazy. Because the solution to this, and I was just talking to Tila, who works up at the front. She's my director of patient experience. I was talking to Tila, and she goes, "It's amazing to me that this solution and this process is so simple, and yet no one has stumbled upon this in a way that has been meaningful enough to get it into mainstream healthcare." And so that's my goal. And so if I can change the way we talk about headaches and migraines, I think that is a step in the right direction. So let's talk about that. So people don't understand. If you're at your workplace, or maybe you're talking to friends or family members, and you are experiencing a headache or a migraine, maybe you've been diagnosed, maybe you haven't been diagnosed. Even with a diagnosis of, let's say, migraines, tension headaches, occipital neuralgia, trigeminal neuralgia, cluster headaches, whatever it is, that diagnosis really doesn't give you a good answer as far as what's happening. Oftentimes the medical doctor will just say, well, this is your diagnosis, try this medication or try this treatment, but they don't explain what is happening. And so what's helpful for you is to understand and then be able to explain that to your coworker, to your family member, to your friend. So I'm going to boil this down to most people with headaches and migraines are going to have what is called a cervicogenic headache. Now, what that means is it's a headache that is stemming from the neck. The pain is sourced from the neck itself and experienced as potentially coming from the head or the face, but the problem is the neck. So cervico, in cervicogenic headache, cervico is really just referring to cervical, which is the spine, the cervical spine, which is just the neck. And then genic is the origin of. So genic being referring to the pain and what the patient experiences. So cervicogenic basically just means from the neck. And then cervicogenic headache is something we find in the literature. It honestly has just sort of made its way into the international classification of headaches in the sort of list of diagnoses for headaches and migraines. It's made it into that list relatively recently, in the past couple decades, I believe. And so it's a relatively new diagnosis. I'm using this diagnosis because it most accurately depicts what is happening. Now, if you get a diagnosis other than cervicogenic headache, it means that the provider is not necessarily considering your neck, or neck mobility or injury to your neck as the source of pain. And that's where it leads you down the route of medication, that sort of thing. I have several podcasts on that to better understand that. How do the medical doctors think, and what's this pharmaceutical route that they will take you down? And so understanding cervicogenic headache means that the neck has the actual problem. The actual problem is in your neck. Your neck needs to be treated effectively, appropriately, because the pain that's generated from that area is then traveling to the head and the face. And this is why it's so confusing, because, well, you've got pain in your head, you've got pain behind your eye, the pain's in your temple, maybe it's just all over. And so let's take an MRI of your head. Let's see what your brain is doing. Let's look at your eye. Let's send you to an ophthalmologist. Let's send you to an ENT because it feels like you have sinus pressure. And so all these things are usually ruled out. So check, check, check. Nothing comes back with anything positive. And so the last sort of explanation, which should be the first thing that we check, but right now in our system, it's sort of the last, forgotten, overlooked source of pain is the neck. So let's just assume, I'm going to make a generalized statement because don't get me wrong, not everyone with headaches and migraines has a neck problem, but the majority of people do. And if you have not been provided with a solution, I can almost guarantee you that your neck is the issue. So just understand, I'm going to say 95%, 90+% of people have this neck problem. So don't, I'm just saying that there's on rare occasions other sources for headaches. But for the most part, you're going to have a cervicogenic headache. And so just headache that's sourced from the neck itself. So if you can memorize that word, cervicogenic, that is the term you should be using when you go to your doctor's office or you talk to your friends or family members. I have a cervicogenic headache. What does that mean? It just means that you have a neck injury that is causing pain in the head and the face. So your neck is the problem, and it has to do with how your neck moves, and this injury has sort of changed the way your neck moves, and it's reduced the amount of movement your neck has. And so that is irritating different structures in your neck and sending pain into your head or your face. So the brain is perceiving pain as coming from your neck as actually coming from your head and your face. So it's a referral pattern. It's a referred pain. So you have a cervicogenic headache. And what that means is that there's a problem in your neck and it's referring pain into your head. Well, what is this problem in the neck? What does that mean? And how did your neck get injured in the first place? So I talked about that in my last podcast of what if you didn't have a neck injury? And so if you're thinking, well, I didn't have a neck injury, then listen to my last podcast. But for the most part, people, and you, the listener, are wanting to understand what is this neck injury and how did it happen in the first place? So the neck injury, and I'll simplify this, boil it down to, it means that specifically the upper part of your neck, so your head sitting on the first bone, should do this nodding motion when you say yes. And when you turn your head left and right, when you're checking your blind spot or backing out of your driveway, your head should be using the second joint in your neck, so the first bone resting on the second bone, to do about 45 degrees of rotation. Half of your movement should come just from that joint. And this injury results in one or likely both of those joints not doing their job. And so those joints being restricted are going to lead to tension in that what's called the suboccipital area in the back of the head, and tension through the rest of the neck because the rest of the neck has to pick up the slack. And then that pain in that area is referred to the head. So you're going to tell people you have a cervicogenic headache, which is basically the neck having an injury, and that pain signal is being perceived by the brain as coming from the head or the face. And this neck injury is an injury that results in a loss of movement. And that's why if you go down the chiropractic road, it can be helpful, but they're focusing on alignment, and imaging like MRIs and X-rays and CT scans are just still images. So explain that to them as well, because, well, your X-ray was fine, or can't they just do an MRI? Like, can't they just look at your neck? Well, not necessarily, because it's a movement problem. So the neck injury results in a loss of movement. And so you can say that many people suffer from this same injury, but the reason that my pain or my symptoms might be different than the next person that has head or facial pain is because this same injury can present differently from person to person. All right, so this is where it gets a little confusing, because people always want to classify themselves into a specific category. If you have pain that is in one side of the head, it's behind the right eye, and you have nausea with it, and you have sensitivities to lights and sounds, isn't that different than someone that just has a tension type headache and pain on both sides of the head that is connected to like shoulder tension? Or isn't that different than someone that has an ice pick type pain behind the left eye? Or maybe someone that has more of like a temple irritation or dull ache throughout the day. Now, there are all different types of headaches, but for the most part, they will boil down to the same neck problem. And so I don't have to have a specific conversation with you. I don't necessarily have to have a specific conversation with you to hear your symptoms to tell you that, yes, this is a neck problem, and this is specifically how it presents. Now, when I have these visits with people, I can with a fair amount of confidence guess is what specifically in their neck is not functioning the way it should, whether it's like right rotation or nodding on the left side, because the pain can present differently in response to the neck, but it also will present differently subjectively. So how the patient just perceives what's happening. It can be all over. It can be more specific, a one-sided presentation. If they have more shoulder tension, that might be more of a tension type where it's both sides of the head. their brain might perceive it as coming just from the eye, and it's this intense ice pick like headache. But any of that type, any head or facial pain can be sourced back to the neck. And so tell people that there are many, many people that suffer with this same type of neck injury, but it can present differently from person to person. So encourage those that you talk to, and be encouraged yourself, that if your neck has not been evaluated properly for movement in the upper part of the neck, if you have any sort of head or facial pain, it is likely that the source of pain is coming from the neck, and you would classify as what's called that cervicogenic headache. Just because your pain might be different than someone else's pain doesn't mean that it's not a neck problem. Now, if you go to the literature and you look at what specifically is a cervicogenic headache, what it will say is it's a pain that starts in the neck and wraps around the head, and usually it's increased with certain neck movements. And so what happens is doctors will have patients turn their head left and right, look up and down, side to side, and if that doesn't reproduce the pain, then they'll say, well, it's not technically a cervicogenic headache. I have seen, so the majority of people I see don't necessarily reproduce their headache when they turn their head, but their neck is still the problem. And just because their pain doesn't increase when they turn, doesn't mean we can rule out their neck. I mean, that's, as far as what I've seen, and as a physical therapist, like, that's crazy. The nuances of movement need to be evaluated, and we need to understand that how we can't just rely on pain to rule something in or out. We have to understand the neck, and we have to understand the upper part and how it moves in these subtle movements, that if I just tell someone to turn their head to the right or the left, I'm really not getting that much information. But right now, that's what we're using to rule in or out a neck problem. All right. So if I'm going to explain this problem to someone else and how it might occur, I like to use the example of a bowling ball, because the head weighs about 12 pounds. And so if you think of, I'm sure you've been bowling. If you go to the bowling alley and you're holding up a 12-pound ball, it's fairly heavy. And so that's how much our head weighs. Our head weighs 12 pounds. And so our neck actually has a lot to do. We demand a lot of our neck throughout the day. And so if you hold that bowling ball, if that bowling ball is just placed on a stick where there's no junction, there's no joint, the stick is just solid, and you're able to place it right on the stick and you support the stick, that stick it's stable enough where it's not going to necessarily be compromised. Well, if you move the stick, or let's say you're holding this bowling ball upright, if you move it one direction or the other and it's kind of at an angle, there's a significant increase in the amount of stress that's going to be placed on you holding the bowling ball, or in this stick example, that force is now placed at sort of an angle through that stick, and it's going to be more likely to like fall off, or it's going to need more support as you're holding that stick. And so think of our heads as being this 12-pound ball, and if we're looking forward, if our head's tilted one way or the other throughout the day, that is going to increase the amount of stress through our neck. We, as a culture, are sitting much more, and so as we sit, we are going to be in poor postures, and that poor posturing can be a reason for this problem. So continuing with the bowling ball example. So the reason I'm using an example of a stick is because a stick, unlike our neck, does not move. It doesn't rotate. It can't bend forward and backward, but our neck can. So remove the stick and add, let's say, like, for lack of a better example, you have Jenga. If you've ever played Jenga, Jenga, when you start, this little tower of block rectangles is very stable. Now, if you put, let's say you put a bowling ball on top of that Jenga tower, and you start moving or taking away certain segments, that segment becomes more mobile. It's not as stable as it was. And so with that more mobility means it's more likely to be compromised. And so when we think of our neck, the middle and lower portions of our neck are relatively stable. Those joints should do about 5 degrees of motion in varying degrees of movement. But the upper part of the neck is where most of our mobility comes from. So it's like having this Jenga tower where you remove some of the blocks from the upper part nearest to the bowling ball. And so that part can move, but it's also going to be the most likely to be compromised. And so what we have is the upper part of the neck, allowing us to go through full range of motion, turning our head right, turning our head left, tipping left to right, looking up and down. But it's also going to be more susceptible to injury. Now, normal daily activities are fine. They're not necessarily going to lead to this sort of neck problem, but it's when we put ourselves in prolonged sedentary positions, or if we have some sort of whiplash injury, motor vehicle accident, playing football and getting knocked out. I mean, whatever it is, whatever your past has provided or done to your neck, there's a lot of scenarios that can lead to this type of injury. So explain it to people as it's like you're holding a 12-pound bowling ball. The upper part of your neck is most likely to sustain this type of injury because it's the most mobile part of the neck. And when it does sustain this injury, this is how it presents. It presents with head and facial pain. And so that, just to recap real quick, you have a cervicogenic headache, which means that you have a neck injury and the pain signal from the neck is just being perceived by the brain as coming from the head and the face. Many people have this type of injury, but it can present differently from person to person. If you have head or facial pain, it's likely that your neck is the problem.